Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. So I wanted to build on last week's topic, which was prepping for an induction and what that means. And so during that, I talked about three things. I talked about Cervical, Cytotec, and a Foley bulb or balloon catheter. And so I wanted to really go a little bit more in depth about what those are, pros and cons, and when it's used. Okay, so we'll start with the not least invasive because they're all invasive to be honest, but with a Foley bulb, you are looking at something that is going to manually dilate you. And so the way that works is that they insert a catheter in your cervix, and it has to at least be a fingertip because you have to be able to get through it, right? And they fill up one balloon on the inside between baby and the cervix, and then another balloon on the other side of the cervix and in the vagina. And as you can imagine, just if you had Play-Doh and you squeezed Play-Doh and put even pressure on either side, it's going to flatten or squish. And eventually, the cervix is going to get big enough where the balloon on the top just falls through. Usually by that point you're 3, 4, 5 centimeters dilated, actually. The great way to start an induction, that's awesome. Pros to it is that you don't have to be hooked up to anything. I long for the day when Green Bay will do outpatient Foleys, where you can go to your doctor's office for an induction in the clinic setting, get a Foley put in, and then return to the hospital when contractions start or it falls out. That would be awesome. They do it other places, but not here yet. So that is the Foley. Now another one is Cervidil. Cervidil is a kind of synthetic ripening agent, and so it's on this little tab of paper, it looks like, and the medication is inside that, and so they apply it to the cervix and it absorbs into the cervix and kind of starts to synthetically soften your cervix so that it can start doing other things like shortening and dilating and things like that. The pro to it, I would say, is that once it's on, it's there, it's absorbed. You could be up and about for a little while, but you do have to be continuously monitored. Another time that it would not work is if your water was broken, because the amniotic fluid would just wash the medication away off your cervix. And so that option is out if your water is broken, but they do need to prepare the cervix for some more medications. Cytotec, I will say, with the caveat, don't Google it. When they first started using Cytotec, they didn't really know what they were doing, and some not so good things happened. And that was especially highlighted in the birth film, The Business of Being Born, and really put a really bad stigma on Cytotec. But I've also seen Cytotec work wonders and only use Cytotec for an induction. So they've gotten much better at how to manage it. I did not go to doctor, or did not become a doctor. I literally supporting, and that's it. That's as far as it goes. And so what it is a pill. And they don't do the whole pill, they do a little bit of the pill, because they learned not to do the whole pill, but they apply that to the cervix, and again, it gets absorbed into the cervix, and it's a little bit more aggressive than the Cervidil, so you do have to be monitored again, and usually you do have to lay there for a little bit with all of them, just to see how baby's tolerating everything and how your body's reacting, because it is something that's not normal, to your body. With Cytotec, again, if your water's broken, you can't do the vaginal Cytotec, but if it is broken, you can do an oral Cytotec. So you would just put it in your cheek, the medication in your cheek, and it absorbs through your cheek muscle and mucous membranes in there. So there's that option as well. Some people prefer that option because they feel like it's a less invasive, it's a different dosage of medication, maybe not as aggressive as physically putting it on the cervix itself. But again, everyone's different, so you'll want to talk to your doctor, medical provider, midwife about what that looks like for them as doctors, their experience, in their, how long have they been using it. Just ask them questions. There's no shame in asking questions. So those are kind of the three ways that you prep your body for an induction. I would say too, usually it's about 3 rounds of Cytotec, and then then they have to wait a few hours, and then they can start Pitocin. That's usually why they have you come in at night, because it's 12 hours then technically on side attack, and then they wait, and then in the morning have some breakfast, and then let's start Pitocin or break your water. So that's just talking a little bit more about those induction options. Obviously, if you have any questions, reach out to us, because that's what we're here for. So I hope you guys have a great Tuesday, and you learned a little bit more about those cervical ripening agents, and let us know if you have any questions. Have a good one. Bye, guys.